Hello. In my previous video, I discussed the 3 layers of thoughts: negative automatic thoughts, underlying rules and assumptions, and core beliefs. One way to address negative thoughts and underlying rules and assumptions is by asking perspective-shifting Socratic questions. The Socratic method derives from Socrates, a philosopher living in Athens around 400 BC. His unique approach involved using questions to help his students reach a conclusion without directly instructing them. Socrates was famously ruthless and aggressive with his questioning, whereas in CBT we take the opposite stance, one of gentle curiosity. So during a CBT session, we want the client to be engaged in a process of testing and evaluating their thoughts, assumptions and beliefs in an empathic, gentle and guided manner. Let's look at Nigel, who's 40 years old and presents with stress due to overwork and perfectionist tendencies. During the process of CBT, we identified the unhelpful belief, if I'm not perfect, then I am a failure. To help Nigel foster critical thinking around his belief, if I'm not perfect, then I'm a failure, we might ask the following Socratic questions that elicit evidence for and against his belief. What is the evidence your belief is true? Or what is the evidence your belief is not true? These probing and open-ended questions encourage reflection and direct Nigel's attention to possibilities that had previously been outside his attention. Socratic questioning teaches Nigel how to evaluate his thoughts in a conscious and structured manner. You might also ask what we call alternative explanation Socratic questions, such as, is there another point of view? Are you paying attention to only one aspect of the situation? Are you misinterpreting the evidence? Are you making assumptions? These questions are intended to encourage active engagement and critical thinking. The aim is to draw Nigel's attention to information that might be outside his current focus. The questions also teach Nigel how to evaluate his thoughts in a structured manner. It may also be helpful to ask Nigel an impact of the automatic thought question, such as, what is the effect of believing if I'm not perfect, then I'm a failure? This question allows Nigel to assess the consequence of responding to his belief. Not every question I've mentioned is going to be relevant to every automatic thought or underlying assumption, so use the list as a guide only. I also want to stress that we're not just firing a bunch of questions at the client. I'm listing questions in this manner for the purpose of this video only. In reality, this process is much more conversational, which is why a lot of therapists prefer to use the term Socratic dialogue rather than Socratic questioning. We also engage in a Socratic dialogue over a number of sessions. As I've mentioned previously, it's a guided process with the therapist fostering a stance of gentle curiosity. Clients often benefit from imagining what they would tell a friend or family member in a similar situation. This is called a distancing question. For example, what would you advise a friend who told you something similar? Good Socratic questions will encourage the client to re-evaluate a negative automatic thought and construct a healthy and balanced thought. Because thoughts and feelings are so closely connected, if you change how you think, you'll notice a corresponding change in your mood. By using Socratic dialogue, you're helping the client to become their own therapist and consciously challenge and change their own thoughts. And finally, you might ask a problem-solving question, such as, what would be good to do now? Or, what would you like to do about this situation? Now, occasionally none of the questions seem helpful, and this can be a sign there are more central negative automatic thoughts or underlying assumptions you haven't identified. Also, the thought or assumption you are trying to tackle may be too broad. And a client may understand logically that a thought is irrational, but not on an emotional level. So this keeps the thought very alive and very sticky. And finally, the levels of Socratic questioning may be too superficial to provoke any change, so you might need to work on your Socratic dialogue skills. Now, there are many different methods to help a client evaluate their thinking, such as varying your questions, identifying cognitive distortions, or conducting a behavioural experiment. Another common tool to change negative automatic thoughts is the ABCDE model, which is on the screen now. Just click the screen to view the video. If you'd like me to make more videos like this, please subscribe if you haven't already done so, and press the bell notification so you'll be informed when I release a new video. I look forward to seeing you soon.